Hello, everyone. Welcome. We would like to respectfully acknowledge that the UBC Okanagan is situated on the traditional, ancestral, unceded territory of the Syilx Okanagan Nation. We would also like to acknowledge that many folks joining us today are from different places, either near or far. And we welcome you to take the first few moments acknowledging the traditional owners and caretakers of those lands by sharing the names in the chat box. If you do not know the names of the lands where you're currently on, please visit the website native-land.ca, and that's been shared in the chat box as well. My name is Kim Peek. I work with the IH Research Department and the BC Support Unit Interior Center, and I'm honored to be your host for today. With humility and gratitude, I recognize and acknowledge that I live, learn, and love on the traditional, ancestral, and unceded territory of the Syilx Nation also. Welcome to the 9th annual Okanagan Embrace Aging Month, and thank you so much for joining us today. Embrace Aging is co-hosted by the Institute for Healthy Living and Chronic Disease Prevention at UBC Okanagan, Interior Savings Credit Union, and also Interior Health. The Embrace Aging Month was launched 9 years ago to celebrate and raise awareness about positive aging. And we have once again organized a number of educational opportunities and events during the month of March. The sessions are designed for everyone, young and old alike, and focus on a variety of topics related to healthy aging and ways to improve quality of life among seniors and their family caregivers. Our goal is to inspire everyone to embrace positive aging. Some housekeeping items of note are the closed captioning function. So the closed captioning box can be moved to your preference by clicking and dragging it to where you would like. You can also turn it off by selecting the live transcript button on the menu bar. All guests are welcome to type questions or comments into the chat box during the presentation, and questions will be read at the end of the presentation today. I'm very excited to introduce today's session titled Want to Help Your Community? Volunteer in Health Research Studies through REACHVC. And presenters are Stefanie Cheah, Manager with REACHVC, and Quigley, Marketing and Communications Specialist with REACHVC. Take it away, Steph and Aisling.
Thank you so much, Kim. Hi, everyone, and thank you for having us today and joining our talk. As Kim mentioned, I'm the manager for a platform called REACHPC, which you'll learn about today. And we are excited to tell you a little bit about different ways that you can give back to the community by volunteering in health research studies. REACHBC is part of the Michael Smith Health Research BC organization, which is a publicly funded organization. So before I go into our presentation, I would like to acknowledge that I'm actually located in Richmond, BC in the Lower Mainland, and I acknowledge that our work is located within the ancestral, traditional, and unceded territories of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. All right, so before we dive too deep into what REACHBC is about, I wanted to start us all on the same page with some basics of what do we mean when we say health research. Health research is sometimes referred to or called medical research or clinical research, but it really means any research that is done to learn more about the human health. And the reason we do it is in order to prevent diseases and injuries, improve treatments and the standard of care for people, as well as finding cures and saving lives for some life-threatening diseases. And research really just can only take place when people participate and volunteer to participate in these research projects. So health research is vital for expanding medical knowledge and making these new scientific discoveries to treat diseases. A discovery like the COVID-19 vaccine, which was recently done, and it was a huge thing for everybody. And why should you volunteer in research? It's really, researchers are unable to do this important work without the help of everyone being willing to say yes to participate in their studies. And researchers are looking for not only people who have a condition who might be sick or have a specific disease, but they also need healthy, and I use quotations for healthy because it just means people who don't have a condition that's being studied. So there's really research for everyone, and everyone can really participate. I'm actually going to ask Aisling to do the next few slides, which will tell you a little bit about how we recently talked to a few people who volunteered in health research studies, and we did some videos with them. And I think it means the most when you hear directly from what people's experiences have been with health research.
Thanks, Steph. Hi, everybody. I'm Aisling. I'm the marketing and communications person here at REACHBC. I joined July last year. And so when I joined, I was new to health research as well. So I wanted to find a way that we could communicate clearly what exactly does it mean to get involved as a health research participant, because it was brand new language and a whole new world to me as well. So Steph and I decided a good idea would be to talk to volunteers themselves. So talk to people who have participated and hear their stories and get them to tell us what is involved in being a healthy participant or a patient partner. So we went out and we talked to lots of different volunteers to see who would be happy to share this story. And then we narrowed it down to 4 videos. So here are a couple of quotations of what some REACH volunteers you'll see in the videos we're about to share had to say. So you can see it's like all ages. So you can participate as a volunteer from like 16 years and up, anywhere as long as you're located in BC. So Sharon had to say it's fun. And in her video, she really went on to say that it was like she felt really heard. And then throughout her life, she always wanted to give back to the community, but never had the time. And now she can. So we'll look at a video where it talks a little bit about her story. Anna said it's something her generation might necessarily know that much about, but it's really nice to feel like she's helping, advance like medical treatment and help as a healthy participant. And then Jeff was a really interesting guy. We loved meeting him, and his story was really sweet. But his wife survived breast cancer, and his dad also, and he really puts that down or attributes that to people being really supportive of volunteering their time in a health research study. So I think what we're trying to say is like the reasons are very pure and why people want to give back, and there is a real like feel good factor when you know that you're doing something that's for the greater good of all. So we'll go to the next slide. I think what we're going to share, I'll share the videos first. So we made 4 videos. So if you're brand new to research and you don't know anything about it and you're like, okay, what's involved? We have 4 videos currently on our YouTube channel, and they're also going to be on our website. So the first video is explaining what REACHBC is. So Steph will bring you through that today. It's a provincial platform where you set up your profile and you're matched. I won't spoil it, but you go on there and have your profile and then you can participate. We have another video explaining what is a patient partner and what that looks like. So I think Steph's going to bring us through that too, but just the different types of opportunities and ways that you can give back. What is a research participant? So what that could look like, is it an online study or a clinical trial? And then the final video is a little bit about like how researchers use the platform. So how do we match members of the public who create the profile to researchers and what that journey looks like? So there's 4 kind of informative, inspiring, hopefully educational videos that we'd love to share. And if you take some time out of your day, we'll share this presentation after and you can click through in this link. But for now, we're going to show you this video. So I think Steph is going to line it up. So this is the video just explaining what a typical volunteer participant might look like. So if you get involved in a study, what that might look like. Hopefully you can hear it. I can't hear the sound, Steph. No sound.
Technical difficulties now. Okay, let me
This
try.
is Sharon, the one I was talking about. Yeah.
Let's try again.
Okay.
Share sound.
I worked and had a really good.
Oops. Oh, what happened? Okay. But did the sound work this time?
The sound worked fine. It just went
okay.
black for a couple of seconds.
Okay. Yeah.
Her time, okay.
I worked and had a really good career, and I had no energy to give back to the community. And once I retired, that was going to be.
Oh, that's so strange. Okay,
It's
okay. We have a backup of maybe I'll try the YouTube channel directly.
I think that would be better because sometimes when you embed it.
Sorry about this, everyone.
I think the video is just a really nice way of like seeing exactly what's involved and what other people, how their experience of being a participant was.
So you
And
can
also
see
just
the
kind of
screen?
show how simple it is. Yeah, I can see the screen, yeah.
I worked and had a really good career, and I had no energy to give back to the community. And once I retired, that was going to be my job, is finding ways to give back to the community.
I do a lot of running participants, kind of booking lab visits, collecting all the data, but we also work with a computer science team that is training this machine learning algorithm that can then predict who is at risk of developing neurodegeneration or dementia later on.
It's fun. You know, you're interacting with people who are really dedicated to what they're looking for, and they'll respond to the questions you ask.
With REACHVC, we've been getting more participants as well, just healthy controls from the community. I just refer them to the website, send them the link. They can just click exactly what they're looking for or not looking for, and then it sends the email notification. It's really a fantastic platform.
It's a very easy to use website with filters and clear articulation of what the abstract of the particular studies are. I just kind of scanned for some things that interested me either personally or I thought I would align with based on my demographics. My wife went through breast cancer, my father went through lymphoma. I'm fairly confident my wife would be dead having the same cancer 20 years ago. But the reason both of them had, one a good experience and one not cured, but certainly in remission, is because previous generations did things like I'm doing, contributed to medical research.
I think it's the kind of thing where when you're younger, it's hard to know about what's going on in the research because you're not the one Googling it or looking for it. That's actually the nice thing about REACH, is that it's easy because they're all on one web page. So it doesn't take a lot of effort on your part. I just said I was interested online. They reached out to me over email and they sent me a little kit where I just took a small prick of my finger, gave them a couple like circles of blood, and then sent it off. It's easy to do, and you have that, you know, warm fuzzy feeling that you're helping other people, and that's something that's really important to me. And I know it's important to people my age. They just don't always know to be looking for it.
It's just amazing when you start looking that you realize like none of these medicines, all of these things wouldn't happen. All this research into solving, you know, different sort of diseases and how to approach them wouldn't work without volunteers, whether it's a healthy or a non-healthy participant. By using me as a healthy participant, they will know if their ideas or their research will actually help. I'm really happy for the opportunity to be a volunteer for REACHVC, and anything that can make life easier for other people who are suffering from diseases in Canada, that's great.
Now I'll pass it back to you, Steph. Thanks, it worked.
Just, yeah, after 3 tries. So that was the video that we created with those participants who shared their stories. And I think they really just said it best of like, we can tell you why we think it's important for you to participate, but really coming straight from people who have participated in the past and what drove them to do so is really means so much more. So we kind of told you that we do need people to participate in research, but you might be wondering what does it look like to participate in research? There was one example in that video about giving drops of blood, which was, I think, studying whether you had COVID-19 antibodies in your blood sample, in the blood sample that was provided. But it can really mean, it can look like a lot of things, the type of health research projects that can go on. It can be something very simple, like completing an online survey about your lifestyle, what you're eating, how you're feeling, and that could be done from the comfort of your own home. You can involve testing a medical device, you know, new equipment, even a new app revolving around a specific condition. It could mean joining a clinical trial where they're studying a new drug or medicine and the efficacy of it. You can also have opportunities to donate blood or tissue for future research work. So just storing your blood sample that lots of different research projects can use to study a variety of different research questions. And Aisling kind of mentioned it before, but not only do we have health research studies like I just talked about, but we have another opportunity that we share on REACHPC called the Patient Partner Research Opportunity. And if you haven't heard about what a patient partner is or what they can do, it really means participating in research as almost like a help volunteer researcher, in the sense that you as a patient with an experience of a lived condition, you're actually providing that experience and sharing that with a researcher in order to make sure that they're focusing on patient identified priorities. And that experience that you've had as a patient with that condition can help change the way a research study is designed or how it's administered. And then there's also opportunities where researchers, there might be like a research program and they have a committee that will help direct where should their research be focused on, and they need a patient to kind of sit on that committee to share their point of view and give feedback on whether they're going in the right direction or not. So really there are a lot of ways that you can get involved in volunteering for health research. So REACHPC came around as a way to help you find those health research opportunities. We built REACHPC, which is an online platform to help raise awareness of health research opportunities in the province and help more British Columbians participate in research, as well as assisting those researchers who need to find the volunteers for their projects. So if you've never been asked to participate in research before, it might be just because you haven't had that right connection to the researcher. Researchers will do lots of things to try to find the right people, like post these posters on a bulletin board that could be at a hospital and hope that the right person with the right demographics walks by and takes their phone number. They might try to get people at a clinic appointment, or if they're going to a doctor's visit, they might try to ask if you're interested in their research project at that time. But really, REACHVC is about bringing this bulletin board idea, but bringing it online to one central resource that anyone in the province can then search for what's available to them, not having to wait for that one specific time where they might see the right poster or get approached by the researcher. So if you go to reachbc.ca, this is the new website that we had launched in April 2020. We have what we call the REACHVC Directory, which is an online directory of all these health research opportunities that are open. We have a search bar that you can search by different health topics, and then we'll show you what's available for in the province at this time. Recently, we made some upgrades to the REACHVC Directory to include a map, so you can kind of visualize where the opportunities are located. And we've also added a lot of filters, so you can kind of search by location or tell them your age so that you can filter out things that don't apply to you. And I'm actually going to go into this a little bit detailed when I do a demonstration of REACHPC. But before I do that, not only can you search our directory for opportunities, you can also sign up as a REACHPC volunteer. So what that does is you'll sign up and create a volunteer profile. We ask you some information about your demographics, how you want to be contacted, and tell us what types of health research topics you're interested in. And then based on that profile that you create, we will then automatically match you to the research opportunities in our directory database and send you the ones that you might be eligible for, give you a chance to review it and learn more about it. If you're interested in a specific project, you can then ask to be connected to the research team and we'll facilitate that connection for you. So at that time, I'm going to pause so that we can actually look at it. Okay, so hopefully you can see the REACHVC website here. We have different pages for volunteers, for the researchers as well. So researchers will have to add their studies to our REACHVC directory. And then we have this tab called Find Studies, which will take you to the REACHPC directory. We have a few quick links here about if you're looking for COVID studies or patient-oriented studies, and you can, or look at everything that we currently have. You can search for a topic or even like a keyword like heart, and then see what comes up here. We have 2 projects here, one related to stroke, one for high blood pressure. And then we have these filters here that I mentioned, so you can filter down what you're interested in by location or by the research team. If you know if you know about a researcher and you're interested in finding what they're doing. So once you see a result from after searching, you can click on the Learn More button and you're taken to a summary of that research project. So you learn a little bit about the details of it, the purpose, where it's located, who they're looking for age-wise. And then if you really want to get connected to this research team, we ask you to join as the REACHPC volunteer. And I'll show you what that looks like in order to join. We have a really simple, quick form. But we also post all of once the study is no longer looking for volunteers, so they're not currently recruiting, they're closed. You can also see an archive of past projects. Just if that interests you, if they have results, they'll also share them through REACHPC. So you can see like what were the outcomes of that research project. So to sign up as a volunteer, we have this short form here, which we just ask you the name, your email, and your password. You set up a password so you can log in to review the matched opportunities that you have. So phone, date of birth. And this is the large menu of health research areas that we have. So each one of these is a parent category that if you open is a drop-down menu of all these sub-health categories. And you can just feel free to pick and choose what interests you, of what types of research you want to be matched to. And we have general health and wellness here, a lot of categories there. We have health systems and technology, men's health, women's health, as well as older adults health. They're all listed here. So you can choose many categories and you'll get matched to a lot of opportunities, or you could be only interested in a specific category, and then we'll match you to those. So I'm also going to log in as a volunteer. So pretend that I've created my volunteer account and I'm logging in. This is our test site. So this information is all pretend data. So this is the volunteer dashboard, we call it. So when you log in, you can see all of your matched opportunities showing up on your dashboard. So you could click on one to learn more about it. This is the full details of the opportunity, we call it. So the one that was on the directory was just a shorter summary view. And now here you have all the information about this opportunity, like the commitment details, who's conducting it, and more information about eligibility here. And then there's these 2 buttons at the top that says, after reading more about this opportunity and you really want to participate in this opportunity, you have a button that says, I'm interested, contact me. Or if you don't think like, oh, this one's not for me, I'm not eligible, you could click, I'm not interested, delete. But if you were to click, I'm interested, contact me, then we connect you to the research team member. Like we'll provide your name and phone number to the researcher and they'll follow up with you so that you can participate in the project if you meet all the eligibility requirements. So I'm going to switch back to the slides. I have the right one. Yeah, this is just coming to the end of our presentation today. We just also want to share how we've supported COVID-19 research in the past 2 years during the pandemic. As I mentioned, we launched April 2020, which is the beginning of the pandemic, and we had been building REACHVC for many months before the pandemic came around. And so we launched it knowing that it could be a useful resource for researchers at the time, as well as the public who might be interested in helping fight COVID-19. We have posted over 50 research projects to our directory over the last 2 years. And those ranged from like surveys regarding on mental health in the pandemic to COVID-19 treatments and research projects studying infection rates. We also did some promotion at vaccine sites and test clinics with these posters here, Help Fight COVID-19, just to really encourage people during this time. There's ways that they could help give back, help fight COVID-19. Just if you can participate in a study, that's sometimes it doesn't take a lot of commitment from you, but it's something that could really help a lot. So those are just some ways we were trying to encourage people to get involved in research over the last couple of years. But now we have, we continue to share these COVID-19 research projects, but we have a range of health research projects currently available on REACHPC, and we really hope that everybody here is encouraged to at least take a look at what's out there and see if that's something that you might be interested in getting involved with. You can always go to REACHPC to find something that might fit you. This is our group of, I just want to acknowledge all the people that were involved with building REACHPC and operating REACHPC. Dr. McMaster, our executive lead, Allison Orth, our director, Robin is our project coordinator, and we also have a provincial REACHPC advisory committee, which has many stakeholders from across the province representing like different health authorities and universities, but also patient partners are a part of that, our advisory committee, helping us really strategically plan how REACHPC should serve the population. These are images from when we were planning the REACHPC platform. We did a lot of engagement and community dialogues across the province to really get input from the public as to what we should be building for REACHPC. So we're pretty happy with how REACHPC is now, 2 years since it's gone live almost. And we're really just trying to encourage people to let them know that this is something out there for them. And if you have people that are interested in, if you or family or friends are interested in knowing more about how you can participate in research, please visit reachpc.ca. Here is my email and Ashling's contact if you have any questions about it. But right now we are really just spreading the word to let people know that REACHPC exists, and to be able to get you to join in order to see what health research is out there.
And I'll jump in as well, Steph, just to mention, I think it's really important to mention about the platform. It's provincial, which you said, so it's across all of BC. But I think the beauty of creating a profile and a platform like this is that you have full control and access over your data. So what makes Reach very individual is when you set up your profile, you get to decide what study you're interested in. You get to decide if, you know, who sees your data. So it's only when you decide on what category and what studies that you click I'm interested in, does the researcher get to contact you then. And you can change it at any time. You can decide if, you know, what works for you. Maybe it's only online studies, or maybe it's like a health issue that's really personal to you and your family. And if you do go ahead and create your free profile today, we'd be delighted. If you need any help, let us know. And also, we're always looking for more stories to share. So if you do have a lovely experience, or you have some questions about something specific that you'd like to do, maybe we can help get you in touch with the right people. But let me know, because we're always looking to share that and let more people know as well. But I just thought it's worth mentioning that, because we're always so conscious of where our data is going. So these profiles are our privacy, like we're very serious about it, and we don't share your information with anybody.
Thanks, Ashley. So I think we have lots of time for questions, if there are any.
Yeah, I'm happy to facilitate those also. Thanks so much, Stefan and Aisling, for the presentation and for the videos. That was great. I look forward to when those come out publicly. I'm assuming it's soon. Is that correct?
Yeah, they're all on our YouTube channel now. We put them up there. So if you want to pop over there, you can like and subscribe and share them. There's like 3 other videos and a webinar we did also for researchers as well.
Awesome. I can search for those in the background and share the YouTube links with folks through the chat. And I also did share thank you, Aisling. And I also did share the REACHVC website link, so then folks can quickly navigate that way too if you go into the chat box. I do see there was one question from Lori, but it looks like Aisling already answered, but I'll still read it out for the group because I see it was just directed to hosts and panelists. So I want to make sure everybody hears. So she asks, or he asks, do you have to be in your home area to participate? I.e., if you filter by location, what changes, or sorry, if you filter by your location, that changes what shows as available. And Aisling says, yes, there's a way you can filter to see which studies are online and which studies are in your area, which is lovely. And thank you, Aisling, for sharing the YouTube link.
I actually want to add something to that too. So for searching on the online directory, just the filtering location, it'll show what's in that location. But for when you're signed up as a REACHPC volunteer with your own profile, there's another question that asks, actually, you tell us where you're located by region, and then another question that says, what's your willingness to travel? So you can say, I'm only willing to travel to in my own region or to other regions, and you can select which ones, or willing to travel anywhere. Or you could also say, I'm not willing to travel. I only want to see online opportunities. So there's that choice and preference that you can state.
Thanks, Steph. That's great. And I welcome the folks too to enter more into the chat box. I'd be happy to read them over. In the meantime, I have questions. So and I'm happy to take the time to ask. So I know REACHVC is unique and specific to the province of BC. Do other provinces have other provincial networks similar to REACHVC?
From my knowledge, there isn't anything as robust or as complex as how we design REACHPC, that with the personalization of the matching of opportunities. I'm sure there's the directory piece where they'll post and kind of pulling from other sources, like here's some opportunities, but there's no personal account where you can say what you want to know about and get that personalized matching, and then the personal connection to the researcher too. So I think there's a directory piece for sure at other provinces, but not the volunteer connection, a personalized matching part. But there are ones outside Canada that are similar to REACHVC, which we kind of modeled them off of. So there's one in Pittsburgh that we kind of looked at, and as well as Scotland has one as well.
So thank you, Steph. And I've heard of other platforms existing as well. And we used to, like before REACHVC's existence, I know that we have our own repositories where we would, collect information, but it wasn't done in such a techie way of being able to, and to have that secured location for information too is lovely. We do have a question from Linda, who asks if REACHVC is connected to the BC Ministry of Health.
Indirectly, yes. So our organization that REACHPC sits under, the Health Research BC organization, is funded through the ministry or the government of BC. So we work closely with them. They're one of our stakeholders and partners, and they're aware of REACHPC, and they've helped promote things that we're related to, but we're not like a direct funder or anything with the ministry.
Thanks, Steph. And then we have another question, which is, and I'm just going to read it out. So, hello, my name is Jonah Petrovsky Christensen. I hope I'm pronouncing that correctly. I'm a student living in Blind Bay, BC. Blind Bay is gorgeous. That's awesome you live there. The traditional lands and unceded territory of the Quigley. As a student of the gerontology program at SFU, REACHVC sounds very promising. As salient research with older adults in our province is welcome. Are there prospective employment opportunities?
Meaning to work for REACHPC, like work for us? Is that just to clarify? Or do you want to use, but it sounds like you want, as a researcher.
Yes, to work for REACHPC. Well, we are growing, so definitely I think if because it's at the minute we're a small little team. It's myself and Steph, and then we have another part-time person that works, Robin. But I think with the pace we're going, we're funding for 2 more years. So Steph and I are really trying to get like the platform up and going. So if we can show and prove that it works in BC, then there's no reason we can't roll this out or share the success of this model with other provinces. So definitely contact us and send us your email and information and what you're looking for, because the more people, the better.
Yes. And I also, I don't know if this is what this, Linda, if this applies to you because you're a student, sorry, it wasn't Linda, Jonah. We are also marketing or trying to promote REACHPC for researchers as well. So not only are we trying to get the public to sign up as a REACHPC volunteer to find these opportunities to participate, but obviously researchers are the ones that are posting or sharing their research projects on REACHPC to build our directory. And so we need to let researchers at SFU know, at UBC know, at other health authorities, other universities that are doing health research, like this is where you could share your research project and build this provincial database that's like a central place where people can go and find these studies. So that's another stream that we also need this health researchers to join, which we have been doing that over the last 2 years, and we're pretty happy with how many people have been using it and finding success with REACHVC for the recruitment. Mm-hmm.
And Jonah says, Joy, thank you for the information. I will share this information accordingly. Thanks, Jonah. And again, Blind Bay, gorgeous, wonderful rural community in Interior.
Oh.
I wanted to add to the conversation, Steph, because you had mentioned, you know, it's growing and it seems to be, and I think I think that it's just of note that REACHBC is fairly new, and that you know, even though it's fairly new, there are folks on it, so it's not as though when folks do join up that they're not.
Yeah, no, I think we have. I don't know what the current number is, but last I checked, it was like almost 4,000 people signed up as a REACHBC volunteer. And for research projects, I think we had like at least over 50 to 100 active research projects. And then the past projects, at least 200, I think we have shared, and they've closed their recruitment. But yeah, we're hoping to get that number up, let more people know. We have an actual, Ashling, I don't know if you want to share, but we do have like this digital campaign that's running right now. So you might see our REACHBC link come up when you're searching Google or your Facebook. You might see a REACHBC ad come up. So there's many ways that we're going to be sharing, communicating about REACHBC to the public.
Thanks, Steph. And I guess I wanted to, and I see Darlene has a question. Before I get to that, though, I just wanted to clarify. Can you clarify the term active research study, what that means?
I mean that the researcher is actively looking for people to participate. So it's open recruiting, like come participate in my study. And then when maybe they're only looking for 10 people. So once they have 10, they'll say, well, we're closed. And then we still have that on our directory, but you'll be able to see whether it's currently recruiting or if it's closed. And if it's closed, the researcher can also share some results from their findings, and you can come to REACHBC to look at that as well. So you can say like, what happened after I participated in this research project? Like, what was the outcome? And we'll share some information about that to REACHBC.
Great. And those studies too, those would have already been vetted through ethics and have all the approvals required prior to going on REACH, right?
That's right. Yes, we ask that the researchers show us that they've had ethics approval, that they're allowed to recruit on REACHBC, and it's all been the researchers have to be qualified as well. So we're actually only open to researchers that are affiliated or employed by a health authority or an academic institution right now. So we don't have any private company run researchers at this time. It's all academic related research.
Great, thank you. Thank you for that clarification. And Darlene asks, and I'm not sure if you guys will be able to answer, but she's participating in the BC Generation Project. Yeah. Is this similar?
So that project, I know of it. It's a BC Cancer run biobank, I would call it. It essentially is a research study. So that's a project that was started before REACHBC was around, but it's a project that asks people to donate blood and urine samples and saliva, other body fluids over a course of time. Like, I think it's a long time period, like 20 years, that they're like collecting all these samples and then they're opening that for researchers to use. So I would classify that as like a research study that could have been posted on REACHBC as an opportunity for you to participate in. So it could have been one of your matches, be like, do you want to participate in the BC Generation Project or another one? But we weren't around at that time. It would have been a really great project for us to share through REACHBC. I remember when it was, they were recruiting for that. So in the future, if there's other projects like that, hopefully you'll find it through REACHBC. And I guess I'd be interested, Darlene, like, how did you hear about the BC Generation Project? Like, did someone approach you or you saw a poster about it? Because in the future, maybe you'd see something, you'd go to REACHBC to find it.
Thank you. And again, to folks, please feel free to type your questions in. Happy to facilitate them over. I can keep going. I can keep going all day. So, so I know that REACHVC is connected to multiple different areas, as you said. So health authorities, academic institutions for researchers to put their research on. Can you clarify what the connection is between REACHVC and the Patient Voices Network? I know some folks are connected to the Patient Voices Network, and could you talk a little bit about that connection?
Sure. Yeah, so we work closely with the Patient Voices Network, and we actually get a lot of people referred to REACHVC through Patient Voices Network, or PVN. PVN mainly is kind of similar, works similar to REACHVC. They have postings on their website for looking for patient partners to join a committee or an opportunity to give feedback on like a health project, but it's not health research is the difference. So Patient Voices Network, they'll have like sit on a part of a hospital process committee, or how did your experience at the hospital or clinical care, help us give feedback on that. And it's not research. So there's a very big difference that for health research, you're actually giving information about yourself, like either data or like your experience or even a blood sample. And that's to answer a specific health research question. But for Patient Voices Network, it's under the sphere of what you call quality improvement for what you receive as clinical care. And so with that division, PVN, they'll post some of our REACHVC, cross-post our REACHVC posting, but say if you're interested in being a health research participant, go to REACHVC to find these opportunities.
Thanks, Steph. And we had a question from Lori about the Patient Voices Network link, which I've shared to everyone in the chat too. And Darlene has answered your question, Steph, about how she was approached about the BC Generation Project, saying it was about 11 years ago, and don't recall exactly how, but might have been in the paper or the news.
Yeah, and that's something common for researchers to do, is take out ads in newspapers or even do social media ads to find participants. So hopefully with REACHVC, they can save money and time to find the people that they're looking for. Because if you think researchers all spending time and dollars to recruit people to their projects is not efficient, and hopefully REACHVC can help with that. We're not publicly funded. We're not trying to make money off of this. This is all really to help support academic health research at this time.
And I know that REACH is connected to the support unit centers because of my role with the BC Support Unit Interior Center. And for folks that aren't aware of what that is, it sits under the Strategy for Patient-Oriented Research, which is funded by the Canadian Institute for Health Research. It's basically like an umbrella coming downwards. And so our center is connected to REACHVC also. And Steph, I believe that's indicated in the form if folks want connection for that. Is that for researchers to connect, or for patient partners, or for both?
Right now, I think we have mainly on the researchers side. So if researchers have never worked with patient partners before to do patient-oriented research, we refer them to the BC Support Unit, which can provide like the resourcing or help training, et cetera, for a researcher to really know how to work with the patient partner. Yeah, I think it's only through the researcher side at this time. But yeah, and also this project, REACHVC, started as a project and idea that was funded through the BC Support Unit 4 years ago now, I think.
And Cheah also shared, Cheah is with the UBC Okanagan Institute for Healthy Living and Chronic Disease Prevention, a bunch of folks, and she shared that Okanagan Embrace Aging has hosted a PVN event for the Patient Voices Network event on Monday, March 14th. I'm registered for it. I'm very excited for that one also, and maybe to bring up the question of REACH and to see their thoughts on it too, right? It's always good to get different perspectives.
Sure. Yeah, thanks. for this opportunity to share more about REACHPC. Again, if anyone has questions, if you can't remember our emails, you can also email info@reachpc.ca, which might be easier to remember, and it'll get to us eventually. I can get that email. So
yeah, thank you everybody. It's nice to come on here and share, and we hope that you can join and go to REACHPC.
Tell more people about it.
Thank you.
Well, and sharing the group of friends, right? To grow community where there is community and where it exists. I think that you know, with the pandemic, it's been really isolating for many folks, and I think that this is a way to grow community in a different way also, and I always see benefit in that. Okay, well, I recognize that it's a little early, but it feels organically the time to close. So we'd like to thank everyone so much for joining us today. And then, we would like to thank Steph and Aisling for presenting. And we also want to encourage everyone to attend other events scheduled for Embrace Aging Month, so happening all March long. And you can visit the website OkanaganEmbraceAging.com for all the events, and feel free to register. And again, the Patient Voices Network one was very complimentary to this REACHVC presentation, and so folks might want to join that one also. So thank you guys so much again. Thanks, Steph and Aisling. Thank you to all the attendees. Thanks to Cheah for being the tech support in the background, making this all seamless and go without a hitch. And we do appreciate. So take good care of yourself and others until we meet again.
Thank you.
Thanks, everyone.
Thanks, Kim.
Bye.
Bye everyone.